Good afternoon, everyone, and thank you for joining us for this week's National Bleeding Disorders Foundation, formerly National Hemophilia Foundation, Wednesday webinar. My name is Fiona Robinson, and I am the series host. Today's webinar is entitled Behind the Scenes, Healthcare Providers in the Ultra-Rare Bleeding Disorders Community. This webinar is being recorded and will be available to the community beginning on Friday, December 8th. We would like to extend a special thank you today to CSL Behring, whose generous support made this webinar possible. We really encourage you to ask any questions you may have today. You can ask your question by using the Q&A feature at the bottom of your screen at any time during the webinar. We'll monitor those questions as they come in, and following the panel's initial discussion, we will ask them your questions. Today, we are in for a real rare treat. We are joined by lived experience expert Frances Rivera Pacheco, who will moderate a panel discussion with Doctors Mosi Williams, Ming Lim, and Amihai Rotenstreich. I'd like to thank our moderator and our panelists for joining us today. And I will turn things over now to Frances to get us started.
Thank you, Fiona, for that wonderful introduction. Hello, everyone. My name is Frances, and today I am a lift expert. I have factor V deficiency, which is 1 in a million. Both my sister and I have it, but we're completely affected differently. And some of the pictures that you see here is me with my family, just because I am a very family-centered individual. And honestly, without my family and my friends, I wouldn't be where I am today. And the last thing that I would say about me is that I do have a podcast, and it's called the Self-Growth Train Podcast. And it's a podcast that combines personal stories, opinions, and research in order to better guide you through your self-growth journey. Now, I would like to have our panelists introduce themselves, and I would like to start with Ming Lim.
Hi, everyone. Good afternoon. So thank you for the introduction and for welcoming to this webinar. I'm very excited to be here. My name is Ming, and I'm an adult classical hematologist at the University of Utah, which is located in Salt Lake City, Utah. And I thought that since it's the winter season, I wanted to share the beautiful sceneries that we have in Salt Lake. If you've never been here before, just some major attractions. We have 5 national parks here that everyone knows about: Zion, Bryce, the Arches, great for hiking or even just walking. And they're all, as far as I know, they're all disabled friendly. And so highly welcome you guys to come. Some other pictures that I have here is our clinic that's on the left side of the screen. This is our brand new satellite clinic center, which is where we practice our hemophilia treatment center, or we now call it our comprehensive bleeding and clotting disorders here in Salt Lake City. And so I'm very excited to be here and to share with you what we have learned and encountered with managing ultra rare bleeding disorders.
Thank you so much. And now if I could please have Amihai Rotenstreich introduce yourself.
I think you're muted. Could you please unmute?
Hi, everyone. Trying again. Thank you, Francis, for the beautiful introduction. My name is Amihai Rotenstreich. I'm a maternal fetal medicine specialist, focusing both on the clinical side, on the research field, on maternal hematology, meaning bleeding and thrombotic disorders during pregnancy. I'm very happy to be here. I wanted to share here the pictures, my 2 cute little daughters. And in the middle, you can see recently a conference of the GRF, the Glanzmann Research Foundation. This is an amazing organization, patient-oriented, focusing on one of the rare bleeding disorders called Glanzmann thrombasthenia, which is a rare platelet disorder in which one of the platelet receptors is either has a defect or lacking at all. And I was very impressed in this conference, and I was very, very eager to hear later on, after the experience of the patient, that many of them attended the conference. And again, I was amazed how beautiful the organization was. And I'm very happy to be here and attend this webinar.
Thank you so much. Mosi Williams, if you could please introduce yourself.
Thank you, Francis. Hi, everyone. My name is Mosi Williams. I'm a licensed clinical social worker at the Hemophilia Treatment Center, University of California, San Francisco, the adult HTC. And so I'm the social worker there. I took over for a long time, social worker and advocate Dana Francis, who retired recently. And I also am on the board for the Hemophilia Foundation of Northern California and also the Hemophilia Council of California board. Personally, I have severe hemophilia A with an inhibitor. And so that's how I first got connected to the community, going to camp and then going to the different conferences, the inhibitor summits put on by NBDF and things like that. And so I'm a strong advocate for people connecting to our community, whether as children and then also just getting to know others in the community. It really strengthens the bonds and your understanding of your own disorder and also connecting with people with ultra rare bleeding disorders.
Thank you so much. I am very excited to start these questions because as a lipped expert, I know how hard it is sometimes to get a diagnosis and also to get providers that understand what is going on. So starting with Ming, I wanted to ask, what advice do you have for healthcare professionals that are struggling to find a diagnosis for a patient with a bleeding tendency?
So I would say my advice for healthcare providers is to also, when we're trying to diagnose a patient with a bleeding disorder, a lot of it is on lab work. We order a bunch of lab, which I always warn my patients about because sometimes they get shocked when they see the amount of blue top tubes they have to order. And so a lot of times I do discuss with my hematopathologist to ask what other avenues we have in the lab, because this is very dependent on which center you're practicing at. Some labs are very comprehensive. They're able to order every lab that you could ask for, and some labs are not. And so my advice for healthcare providers is just to talk to their hematopathologist to know what kind of labs that they can order to work up this rare bleeding disorders, especially if you have already ruled out the common bleeding disorders such as von Willebrand disease and they're not hemophilia carriers or have a hemophilia disease.
So it is a process that like takes a while, and it depends on the center. Like, how do you follow up with the centers and the labs? Because I know that for me personally, it took a while to get my specific diagnosis. Is there like a way to speed up the process, or is it just something that like automatically it's going to be something that takes longer?
I would say it does take time because I like to try and avoid like ordering every single clotting factor under the sun. I don't think that's fair for both the patient as well as healthcare resources. And so I do try to do as a stepwise approach. And I do tell them in advance during my visit with them is that this is what I'm going to work up for first, because these are the most common. And if they are normal or does not lead to a diagnosis, these are my next steps. So I like to give people the idea that this is not a one-stop clinic. I'm going to work with you through this, because there is also a possibility that despite all the testing that we do, we may not even find a labeled diagnosis, even though the person clearly has a bleeding phenotype. And so it's just providing the education and counseling that we'll work through together to find out a diagnosis. But it is a stepwise approach and will take some time.
And I now have a question for Amahai, because I'm wondering, since you specialize more with the maternal aspect, are most of your patients already diagnosed, or do they come to you also to get diagnosed?
So most of the patients that I see are, of course, pre-diagnosed already. They have a pre-existing bleeding or thrombotic disorders. But sometimes there are some bleeding and thrombotic disorders that reveals themselves during the course of pregnancy, either during pregnancy itself or in the postpartum period. So we have to be very, very delicate to every sign and symptom that the patient exhibits. And sometimes it can be very subtle. In several bleeding disorders, the phenotype can even improve during pregnancy. We know that one of the most common inherited bleeding disorder for Willebrand disease type 1, which is the most common bleeding disorder, presents in 1% in the population, tend to improve during pregnancy. meaning their bleeding phenotype gets better. And only sometimes they have late postpartum hemorrhage. So we can think that, oh, wow, this woman doesn't have any bleeding disorder if we see her during the pregnancy. So we have to be aware of all these little signs and symptoms. And I want to say something for the patients themselves. You are your best advocates, meaning if you feel that your healthcare provider doesn't give you all the attention you need, you feel dismissed sometimes, it's okay. That's normal. Sometimes not everybody knows everything. That's how it is in medicine. And if you feel you need a second opinion to get a different consultation, don't be shy to do that. You are your best advocates.
I love that you're talking about self-advocacy because that is something that I'm very, very passionate about, and I think is so important. And like even what you're saying, like sometimes you do have pre-diagnosed individuals that come in, and then sometimes you get to diagnose them later on. And that brings me to Mosi, because I know that as a social worker, you're probably seeing these families come in as well, like frustrated and all of that. From a provider standpoint, like, is there any advice that you can give them when they're trying to diagnose a patient and they really like they come to the point where it's like, I really don't know what else to try?
Yes, and I want to say that it's really empowering to hear from Dr. Ming and Dr. Amihai in terms of, that no one gets it all right all the time. There, we can miss things. People can feel dismissed, and sometimes patients do feel that. And so, for that reason, one thing that can be helpful is for us as providers, and even myself too, as a non-medical, but as a therapist or counselor, to think symptoms instead of label. And this can be while we're waiting for the diagnosis to come back or even afterward, because we know that sometimes people who are severe, as I am, severe bleeding disorder may not bleed that much. Some that are mild or moderate by the label, and we're thinking about women with bleeding disorders, it may not fit. And so if we're thinking about symptoms and treating symptoms and say, okay, these are the things that are happening to you, how can we work with these despite, what the diagnosis says? And similarly for in counseling is that, the experience that somebody has, regardless of whether it seems to fit the situation, that's, with clinical things like anxiety, somebody may be afraid of opening a door. We may think that that's not valid, but that's what their reality is. So I'm treating them and meeting them where they're at, and how can we help them with those symptoms based on what they're feeling.
I love that. I guess like we don't really think about the importance of like focusing on the symptoms. Like we're so focused at times to get a label because we want to like find something that we can just tell people like, hey, this is exactly what we have. Can you just help me? But I think that you provided like a really different perspective of like, no, let's look at the symptoms and treat them as they come, which I I have to ask this to all of you guys, and we can start with you, Mosi. Like, where do you turn for help if you encounter a bleeding disorder that you don't have experience with? So not so much like not just the symptoms, sorry, but the symptoms and a bleeding disorder that is like, oh my gosh, like I've never seen this in my life. Like, what kind of steps do you take at that point?
Mm-hmm. Well, as a social worker, starting off by validating the person and what they're experiencing and saying, like yourself, Francis, you are the lived expert. You are the expert of your experience. And so what I can tell you is may or may not fit what you are going through. And what happens with our team is we have pre-clinic meetings and post-clinic meetings. So we're able to share the information that we receive from the patients and say, okay, this is what we thought going in. This is not fitting. What are the next steps? What else can we do? What are the symptoms that they have? What are things that we can do to mitigate those symptoms? And then if not, what are other tests that we can look at? And for us personally, for me personally, we have a social work working group that other hemophilia social workers can go to. And also our providers, the medical providers, have their own colleagues too that they can consult with and look at, have you seen this before? And, we have research journal clubs and things to talk about these cases and case conference.
Thank you so much. Amahai?
So again, as I said, sometimes we don't know everything. We have to acknowledge that. That's why I think for the patients, the best thing to do is to have a multidisciplinary clinic when physicians from different fields can come together and discuss the symptoms, the signs, to see how that adds up. I also want to say that sometimes, despite thorough evaluation, and you can do the evidence-based evaluation exactly as you need to, but the evaluation comes out negative, meaning we didn't find any explanation for the bleeding tendency. Again, even at this stage, we cannot say that we didn't find, we can say that we didn't have the diagnosis, but there is still something called a bleeding disorders not otherwise specified. We have a bleeding tendency, but we didn't find the diagnosis. Many bleeding disorders, particularly those that involve platelets, our tools to diagnose them are still limited. Some of them are only experimental, and even in the most experienced hands, it can be missed. So again, I'm saying to the patients, don't be dismissed. We have many tools to help us, to guide us, beside the diagnosis, beside the laboratory test. We have self-assessment tools, self-assessment bleeding BATs that patients can use to see whether or not they do have a bleeding tendency. Patient can do that at home prior to the visit at the doctor to see whether or not the symptoms fit. Many women that I see who face heavy menstrual bleeding sometimes are dismissed because, oh, that's okay, heavy menstrual bleeding is so common. That's okay. And we have to be aware that in some cases, not the majority, but in some cases, heavy menstrual bleeding can reveal an underlying bleeding disorders. So again, I'm saying always we need to be aware and be sure that we're not missing anything. And still, despite thorough evaluation that can be completely normal, we still can say the patient has a bleeding tendency, but we didn't find the correct diagnosis, the cause why the patient he or she has a bleeding disorder.
I love the what is it? The focus on keep saying like, listen, even if it comes up that there's nothing, we do understand that there are these symptoms going on. Like, don't give up and keep trying to find what you have. Because I think that as a lived expert, right, and like just as a patient as a whole, there are times where we do get frustrated and we get unmotivated to keep trying, especially if you keep doing these tests and all of that. And Ming, I want the same question for you, but I also wanted to add, like, how do you deal with that frustration, both as a provider and like helping the patient deal with that frustration?
So to answer your initial question on what do I do when I encounter a bleeding disorder that I've not experienced before, I have to say this is a very common scenario, only because as you're aware, the ultra-rare bleeding disorders are really rare across the country. And so because I'm an adult provider and most people with ultra-rare bleeding disorders were born with it, I actually have the privilege and the luxury to actually ask the patient in front of me, how have you managed your bleeding disorder in the past? Have you had any surgeries? What have people used to treat you? Because they are actually the live experts. I'm actually learning from them how they've been managed in the past. And so that's always my first question to them. What bleeding symptoms have you had in the past? How have you managed them? What has worked? What has not worked? What have you tried? What post-operative complications have you had? Granted, I've had some people who never needed any surgical challenges. And so the first time I'm seeing them is actually when they're going to have a baby. And that presents its new challenges to itself. And I'm sure Ami High has the same situation where there's not a lot of data out there on how to manage pregnancy in women with ultra-rare bleeding disorders. And so when it comes to that point, if I don't have anything to guide me, that's when I go to the literature. We have very prominent experts around the world who have written review papers on how they manage patients. What I would say is that those papers are usually very helpful as a guideline, but it may not apply to the person in front of me. So that's kind of where I would adjust some of the management guidelines that they have. And also in certain specific situations, for instance, if someone wants an epidural, that's often not commented on in a lot of guidelines on managing ultra rare bleeding disorders, and that's when I go to go in even case reports. So an N of 1. Unfortunately, sometimes that's all the evidence we have, and that's where I would look up the literature and so ask my colleagues around the country, because not every case that we see that's unique, providers or clinicians have the time to write it up. And so even though there may not be a lot of patient literature, I do reach out to my colleagues around the country at big academic medical centers to ask them like, hey, have you encountered this situation before? Can you share with me what you have tried, what has been helpful? And that's kind of how we all learn from one another for that purposes.
I have to say, I love that you talked about the epidural, because as a woman with a rare bleeding disorder, I wasn't aware that for me to get epidural, I had a back issue. I had to get treatment before getting the shot, because in my head, I'm like, it's just a shot. Why do you need to give me this? So it's interesting, like how there are things that even within my bleeding disorder, or like within the bleeding disorder community, I am still learning about after 28 years of being diagnosed and living with my diagnosis. And even you mentioned something about surgeries. And I literally last week I had surgery, and it was so interesting to see how these doctors that had never seen somebody like me, there was like different attitudes going on. It was kind of like, how do we help her? But also I'm terrified of helping her. And they went to the research, the same thing that you said of like, you know what, this is a surgery that has to be done, and we just have to figure out how to do it. And I think that can be scary for patients and providers as well, because it's like, you don't want to treat the patient as a guinea pig. But there will be times where, unfortunately, we don't have the documentation, or we don't have the resources to like treat you. So we just have to try whatever is available to us. So I thought it was awesome that you mentioned that. And to that end, like now I have to ask, like, because of your experience of so many years, and this goes to all three of you, what do you wish you knew about the ultra rare community that you didn't know before? Like, I know that even for you, you mentioned, Ming, that there's still bleeding disorders that you're learning about, and you're like, oh. So is there anything that you wish you knew, or something that you've learned that you're like, you know what, for the new and upcoming providers, or even providers that have been performing for years, like, is there anything that you would advise them about the ultra rare bleeding community?
I think from my perspective, what I wish I had known earlier is that they are actually out there, and a lot of them don't have major bleeding phenotype. They do have the menorrhagia, which the management is kind of standard regardless of what ultra rare bleeding disorder you have, using possible birth control, contraception, or antifibrinolytic agents. And so it sometimes it surprises me when when these patients come to my clinic, and when I ask them, they say, oh, we never really had an issue, and so they never really follow up with a hematologist once they were diagnosed. It just because they were kind of told, well, you have problems, only come back and see us. And again, we're not trying to ask people to come and see us every year if not needed, but I feel like there's a lot of them out there, more than we realize, and it would be nice to be able to learn about their natural history. Again, these are so rare that all of us have only seen one or two. And so if there's someone out there who can create a natural history to learn more about this unique population of patients, that would go a long way in educating everyone, both providers and the people who are living with this.
I agree with you 1,000%. And I hope that more people start coming up. And I know that I even have people in this community that are like, well, it doesn't really affect me. I'm just not going to go and do it. And it's so important to go, because again, like you said, like there's probably way more than we think there is, and we just don't know. Amahan?
Yes, I just want to add up to the wonderful thing that Lynn just said, that also regarding the natural history, because the standard of care of treatment improves during the years, we see along the years different manifestations of women and men with different bleeding disorders. I just want an example, to give an example of one of the severe bleeding disorders called afibrinogenemia, in which there is a deficiency of fibrinogen, which is one of the critical factors in the coagulation cascade. And it was evident in the recent years, and I was involved in one of the publications, that these patients, during the course of disease, later on, despite not bleeding tendency, but thrombotic disorders. So that's completely the opposite of what you would have think. And the reason why it was not revealed before is that, unfortunately, these individuals tended to die at an earlier age. But now, when they age and they develop atherosclerosis, which is accelerated in these patients with afibrinogenemia, we see that they experience more thrombotic disorders than the general population. And that, again, was not evidence up until a decade ago. So again, we're learning during the course of the disease and as the science progresses that different bleeding disorders can exhibit different manifestations throughout the years.
I find science and history and all of this fascinating. Like the fact that if you think about, I don't know, like less than 100 years ago, most of us didn't even have like proper treatments. And then all of a sudden, like with all of these new upgrades coming up and like new ways, not just to treat, but also to diagnose, and not just to diagnose, but also, like you said, like because of being diagnosed with something else, all of a sudden we're seeing a trend of, oh, wait, people that have this tend to also have this. It's so interesting how everything connects, and also like how much we still have to learn. Like this is a silly story, but like when I was younger, so because I have factor V, I used to think that what if I had a husband that had hemophilia A, and then we got married and we had a baby, and like, is our baby gonna have factor 13? Like that was the way that my brain worked. It was like, it's math, it makes sense. A plus 5 equals 13. So that tells you how much science I like. Mostly, how about you?
That was a cute story, by the way. 8 was 5's 13. For me, I think, and from a social work perspective, realizing that people with hemophilia feel marginalized, but then ultra rare can be even more marginalized within our population, and just thinking about how frustrating that can be, whether it's in a community setting, in a camp setting for children. And like you mentioned, sometimes other people with other bleeding disorders that may be more common aren't concerned for them. You know what I mean? And think, oh, it doesn't affect me. But we have to look out for everyone. And I think knowing that, I wish I had known about some. I mean, I just learned from Dr. Amihai 2 minutes ago, the other bleeding disorder he just mentioned. I'd never heard of that. And so what I try to do is, as soon as we hear, and we have a great community, is connect. So if we have one patient with factor V, when we meet them and get connected with them, help them get resources, we'll ask them, if there's someone else, would you be willing to share? Would you like to connect with them? And so we try to do that. And we have a number of patients that are just like on speed dial, say, let us know. We'd love to talk to whoever. And this is how they make themselves available. So just making that connection so they don't feel alone.
I love that you mentioned that, because that is something that I do now whenever I go to the conferences, especially because we get to see people, the national one, we get to see people from different states. And so the pool of possibilities of meeting somebody else like me is even bigger. And I'll always say, like in Puerto Rico, there's a couple of people that have factor V deficiency, they're babies. But I always tell them, I'm like, listen, this is my name, this is my number. Please tell them to call me, because even though they might not go exactly through the things that I'm going through, my mom can act as a resource. I can act as a resource. And like, obviously the providers that we used to have can also act as a resource. And I think that's so important. And that's why the foundation, like the National Bleeding Disorders Foundation, is such an important tool to network, even when you have an ultra rare bleeding disorder and you don't know people that have the same bleeding disorder that you do. I mean, honestly, like there was a time where I would go to these meetings and people did not even have anything about factor V deficiency. It wasn't until 2 years ago when I went to the national conference that I saw it up on the screen. And that was very powerful. But that didn't stop me from continuing to go to these meetings and meeting all of like everyone, regardless of like their diagnosis, because I wanted to make sure that I was within a community that knew exactly what I was going through. And also, even if they didn't have the same exact diagnosis that I did, they could point me to different resources that I could later use myself. So I think like building community is so important. Well, I have a question for all of you. And it's, what makes you the most optimistic or gives you the most hope for a brighter future for people with ultra rare bleeding disorders? And this can be anything in regards to like research, or it can be like a change in regulatory approaches or initiatives, like anything that comes to mind.
Well, I'm going to jump in first. And so I think what I'm very optimistic about is there's increasing recognition for the ultra rare bleeding disorders. And I think we mentioned this earlier, that there is a lot of focus on hemophilia and von Willebrand disease, but there is other rare bleeding disorders out there. And so it was very timely, in my opinion, that the formerly known as National Hemophilia Foundation, made an executive decision to change their names to National Bleeding Disorder Foundation, which now encompasses all bleeding disorders in that category. And so I commend them for doing that. The other thing that I'm very optimistic and hopeful for the future is that when we look at the novel therapeutic agents that are now being developed in the hemophilia sphere, some of those therapeutic agents may be applicable to other ultra rare bleeding disorders, just it hasn't been tested yet. And so I can see a lot of drug companies that are now noticing that this is a niche area where there is not much treatment available. I mean, for you, Francis, with having factor V deficiency, if you were to have a bleed, the only option right now is fresh frozen plasma. And that is the same for a lot of other ultra rare bleeding disorders, because we don't have a dedicated clotting factor concentrate for it. And so it's been very hopeful for me as a physician when I see companies taking on the task of creating, maybe not even novel, but at least creating a dedicated safe therapeutic options for the ultra rare bleeding disorders. And I'm hopeful in that what we are seeing coming down the hemophilia pipeline of von Willebrand disease, those medications, once approved, can then be used possibly, and I don't know that for a fact now until we have more data, in the ultra rare bleeding disorders.
I love that you mentioned the change of the name, because that for me was a very powerful and like meaningful move as well. I think that a lot of times we focus so much on representation because we want to like, you know, be represented. And like to your point, like we were talking about like ultra rare bleeding disorders, we might not have the representation, but to be able to have that visibility within a name where we are being encompassed in like a whole title, because it's not just one bleeding disorder, there's multiple bleeding disorders. And to be able to like now have a foundation that recognizes both verbally and visually and just like in everything, like I think that was such a wonderful thing to do. And I love it. Like that is something that gives me a lot of hope, actually. So I'm so glad that you mentioned it. Amahai?
Yes, I can say that for me, the bright horizon is always when I see a worried woman or a worried couple that comes to me and think, are we going to become pregnant? Is how the pregnancy is going to go? How are we going to face this challenge? Am I going to have a healthy child? And I can say that despite that in many cases, even that we don't know the diagnosis, and of course, in cases that we know the diagnosis, our treatment is usually leads to favorable outcomes. And that's something that I think every woman, every couple who face a bleeding tendency should know, that their chances of having a normal course of pregnancy and having a live-born healthy child, the chances are very high. We need to be ready. That's why I always say that preconception counseling is not only for the patient, it's also for the doctor. We need to be ready. We need to set up a plan, discussing different scenarios. Sometimes in bleeding disorders, when we know the gene, and for example, both of the parents are carriers of the disease, sometimes we can do treatment prior to pregnancy and choose embryos during in vitro fertilization treatment to choose the embryo that are healthy, that do not contain both defected genes. This is another option that patients should be aware of. And if we discuss everything, we are prepared. The patient and the couple feel safe, feel they are ready. And I think that's a very important thing, very reassuring thing to tell patients that pregnancy can usually be achieved successfully and having a healthy child. And that's for me the brightest point.
And I love your brightest point because that is something that I want in my future. And the fact that you're saying it, it just makes me happy and it makes me optimistic and hopeful for the future.
Happy to make you happy.
Yeah, for me, you're seeing the new treatments that are available, seeing our community embrace change, like particularly with the name change of NBDF, and looking at different treatments, having the opportunity to discuss those with patients and see them be excited and see them want to know, other people's experience with those things. That's encouraging. As a patient myself, as a hemophiliac, I'm excited for them. I think I'm a little happy, jealous too, because some of the stuff is here now, and I'm like in my 40s, so I already have some joint issues, so it won't help with that. But there's so many treatments out, particularly in gene therapy, and that being applied in other disease states as well. So yeah, that's what I'm excited and encouraged to see the advancements, and also to see our patients who are, I think earlier was mentioned being a guinea pig, but being willing to take a chance, a safe risk relatively, for themselves, and also to possibly advance treatment for our community.
Thank you so much for that. And listen, I totally get the little jealousy. I think a little jealousy is healthy. A little jealousy is healthy. Well, I am going to pass it to Fiona because I believe we have questions from the audience.
Yes, we do. Thank you very much, Frances and doctors. That was a really insightful discussion and so wonderful to hear also your optimism and hopes for the future. We will now go ahead with our live Q&A, and just want to remind our audience that if you have a question for our panel, please pop it into the Q&A feature at the bottom of your screen, and we'll do our best to answer all of your questions. Here's a question that has come from an audience member, and they are asking, what would be your recommendation for a young adult who's still searching for a diagnosis and who has been to many of the top centers in the US with no luck? And they provided a little summary of sort of their journey so far. So they don't have a diagnosis. They have a very high annual bleed rate. They're on VWF factor every other day, using very risky surgeries to control bleeding. What would you recommend for continuing this journey, or would you recommend just trying to live life with things as they are?
I'm going to try and answer this one. And first, I am very empathetic to your situation. It is very challenging and difficult when you clearly have a lot of bleeding issues that need to be treated and managed. And despite your travels to multiple top academic centers, they have not been able to identify a particular diagnosis for you. I will say that this is becoming more common from what we're seeing in the general population. And even though we don't have a specific diagnosis like factor 13 deficiency, what the hemostasis community have realized is that in order to get patients the care that they need in terms of hemostasis treatment, the hemophilia community has come up with this label called bleeding disorder of unknown cause, called BDUC, where people clearly have a very strong bleeding phenotype, but regardless of all the testing that we do, even to the point that you can do a comprehensive bleeding disorder panel, which looks at over 70 genes for known common bleeding disorders, and it's all negative. And so when it comes to that point, I tell my patients that, unfortunately, our medical technology even though we think it's advanced, have been limited on how we can diagnose you. But let's focus on taking care of your needs. And that's what I think Mosey and Amihai came up earlier, was that we want to manage your symptoms. Yes, having a diagnosis would be great, but I think at this point of time, managing your symptoms safely and efficiently would be the way to move forward. And always touch base with your providers, because yes, right now we don't have a diagnosis, but medicine keeps on advancing, that in 5 years, 10 years, 15 years, maybe we would have a diagnosis then, as we learn more about more diseases in the general population.
Great, thank you. Do any of the other panelists want to comment on this? I would be interested to hear from all of you.
I can add up. I can also feel for you. I feel your frustration through the text you shared. I want to tell you that believe in yourself, find a doctor that believes in you and you believe in him. And don't chase the title of diagnosis. The fact that we can call the disease bleeding of unknown cause or bleeding not otherwise specified, that does not lessen your symptoms or their severity. So continue to live your life. Don't chase the correct diagnosis, the name of it. That does not matter. We are here to treat you, to help you, and to cross all the challenges that you may face. I would also say that I don't know the kind of evaluation that you said. You mentioned that you were in the top centers. Ask your doctor whether there's something experimental that they did not check, whether complete genetic evaluation that we can now perform, electron microscopy looking for different platelet disorders. I think maybe that have been already carried in your case, but I'm just making more suggestions. Always ask, because even if this evaluation has been carried 10 years ago, things are changing. So always be aware of that as well.
Great, thank you. Mosi and Frances, I'd love to hear from both of you on this as well.
Sure. Yeah, and echoing what our doctors have already said, I'm really sorry that you're going through this. I know you may feel dismissed, you may even feel gaslit and hurt, and just I know that you may be looking to understand. Finally, I know what's wrong. But in the meantime, don't be afraid to continue to seek other opinions. And I know you may get tired going from doctor to doctor. And one thing that you can do, and you're already connected here, if you're part of this Zoom, you're connected with the National Bleeding Disorders Foundation, and they can provide support in connecting you to regional organizations that can help. There may be chapters, I don't know where you are in the country, but chapters that are near you that can connect you with others with similar experiences, or just helping you to get connected to other people with bleeding disorders, and also to help you to get support, and then possibly find other ways that can help your case to be known. So these organizations can take on some of this burden for you in terms of trying to help you find the next step. Because I can only imagine having to seek my own care for other things, you get tired after a while because you're fighting so hard. And so there are others here. We're here to help you to take the next steps and to continue to try to help you get the care you need.
I am going to piggyback on what Mosi said. I think it's so important for you to reach out to the resources that you have. And this is including the National Bleeding Disorders Foundation. It's including the local chapters. It includes your local HTC, even your Facebook pages. There's so many groups that I have put myself in rooms that I have put myself in, that do not have people that have the same thing that I have. Because I'll tell you this, a diagnosis, I understand wanting to get a diagnosis, but even as someone that has a diagnosis and not having others like me in the room, I can tell you and guarantee you that by getting involved with your community, it's going to help your mental health tremendously. Because there's nothing like feeling alone. There's nothing like feeling frustrated and not having answers, but having people around you that know exactly how you feel and can provide that type of support. And this is not to say that your family and your friends can't understand you. It's just your family and friends, if they're not affected by a bleeding disorder, I'm going to be very honest. The reality is they can only understand you to an extent. But by having people around you that know exactly what you're going through, from the diagnosis process to dealing with your symptoms to managing your bleeding disorder, you feel a sense of, I know what's going on. And like it gives you kind of like a control and kind of like a stable ground and foundation where you're able to advocate for yourself more, because guess what? You're not alone. There's other people that have also gone through that. And you can always reach out to them whenever you feel down, because that does happen a lot.
Great. Thank you all for that. I think that's really helpful. We've had another question come in. This is somebody who has a platelet deficiency, and they've had their son tested and found that he also had it. But during the testing diagnosis process, the professional they were working with seemed to think that they wouldn't, that their son would not have the same sort of bleeding disorder despite their apparent bleeding. Why do you think some doctors are reluctant to test other family members, and what can we do to help educate them? Maybe I'll throw that first out to Amihai.
Thank you. First of all, again, I'm sorry for your frustration. I'm sure you want for your son the best. And I wouldn't say that the doctors are reluctant. I would say that sometimes they themselves are not so aware and experienced in treating these rare bleeding disorders. So again, my main message to you is don't be dismissed. You can be the best advocate for you, for your son. I can suggest, if you think that you're not getting the right treatment, try to see other doctor, try to see whether there are support groups. As I mentioned, for example, I don't know which bleeding deficiency that you described. Is this Glanzmann? Is this other rare platelet function disorder? There are support groups for this kind of bleeding disorders. So you can try reach out to them as well. I'm sure that during the way, and if the tests show that your son has similar bleeding disorder or the genetic diagnosis of it, you will find the right doctor for you. So again, don't be dismissed. Advocate for yourself and your son, and I'm sure the way will be good for both of you.
Thank you. Dr. Ming, can I ask you, do you have any thoughts about how to educate and advocate to maybe reluctant testing, or if you have professionals who are reluctant to go ahead with testing?
Similar along the lines of what Amihai had said would be to advocate for yourself. And again, this is when it comes to ultra-rare bleeding disorder, there are a lot of physicians who are not comfortable or don't have the expertise or knowledge. And so you can always reach out to other physicians, even around the country. I'm going to put it out there that most physicians I know who deal with ultra-rare bleeding disorders are very approachable. They do not you emailing us to share with us about your issue. And if needed to be, I've actually even called other providers, like, because if someone's too far away to come and visit me, I said, I'm willing to talk to your doctor just to understand better why is there hesitancy, just to brainstorm. We're not here to say anyone is doing anything wrong or not, but just to have a healthy discussion to figure out how we can help this patient the best that we can.
Great, thank you. Maybe if you'll permit, I will move to another question. I wanted to ask you all, how do you think we can attract more of your peers to acquire the expertise and the confidence necessary to support people with ultra-rare bleeding disorders? Maybe you can start with you, Mosi.
I think, there's a balance between, it's a tough one because I think that sometimes it may be too traumatic for some people to maybe want to work in the field because of their experience and to be involved. I can understand for some people that they may feel burned out if they've helped in our community for a period of time and dealing with their own bleeding disorder or complications of things. That can be part of it. Then also just it being too close to who they are. I would say a good way is just to start light, maybe just attending events and things like that, and see, how you feel with that, because they're in the leagues. I think people should feel valued for their for what they have to say. And I think that sometimes people think that they don't have much to offer. So I always say, you know what, you have an experience that you can encourage people just by being here. So there's two sides where people don't think they have much to offer, and then sometimes people have offered a lot and then may be overburdened as a result.
Right, thank you. What about you, Dr. Amahai? Can I ask you, how would you try to draw other people from your profession to acquire the expertise and the confidence to deal with these patients who so often, seem to run into professionals who don't have that expertise or confidence?
So I think what we can do as healthcare providers is to participate in events like this, in other conferences, other professional meetings, discuss the importance of treating these rare bleeding disorders, and attract others. I believe many physicians here sometimes are afraid to deal with these bleeding disorders because it's like a black hole for them. Many prefer to deal with the bread and butter of the field that they face. But I think that's the beauty of it, because we have to acknowledge that we don't know everything. Sometimes we have to go to literature. Sometimes it's only based on a few case series or scattered case reports. But I think that's how we should approach it.
Great, thank you. And Dr. Ming, can I bounce the same question to you? How would you try to attract some of your colleagues to acquire the expertise and the confidence to provide the care that people with bleeding disorders need?
So this is a tough one, I would say, only because when we say to acquire the expertise, given the rarity of this condition, who is an expert? I don't think I'm an expert either. If you have treated one patient, are you the expert? If you have treated two patients, are you the expert? And so I feel that attracting people to become experts, it's going to be very difficult given the rarity of the situation. Attracting peers to have the confidence, I think that we can help with, because what we can do is, a lot of situations, like with surgeons or with OBGYN or MFM, there's multidisciplinary approach. And I feel that my job as a hematologist is to work together with the surgeons or the MFM or any other physicians helping to co-manage these patients, and to share with them the experience that I have, the knowledge that I have, so that they feel confident in managing the patient collaboratively. And so it's not that, oh, I'm the expert, you're not. It's we have to do this together. And in that situation, I'm also helping the peers in the sense that, oh, they've managed one patient with this very ultra rare. Now they've had an N of 1. They will feel a little bit more confident in managing the next one that comes through their door.
Great, thank you. So I'm going to impose upon Frances now to maybe do a little bit of a wrap up. And I think Nicole had another slide or two that she wanted to share. So I'm going to ask her to share those, and I'm going to pass on to Frances here for a moment.
Yes, I want to thank everyone for being here today. It has been amazing. I've learned a lot, and I loved our panelists. And if you haven't had a chance yet, please make sure to check out NBDF's ultra rare educational resources. They have educational materials, factor deficiency booklets, which, by the way, I always carry mine when I go to the ER. The ultra rare factor deficiency webinars, just like this one. And we also have the additional resource, the rare coagulation disorders form. And this is for healthcare providers. And then I also wanted to invite you to the NBDF Bleeding Disorders Conference happening in Atlanta, Georgia. This is going to be happening next year on September 12th through the 14th, 2024. You will see myself there, gracing the beautiful halls of the hotel. I am very excited to go and meet everyone and just, get back in touch with the people that I have met over the years. Thank you so much, Fiona.
That is my pleasure. Thank you so much, Frances. And I'm just going to move on to a little bit of further business, and I'm going to drop the links to the resources that you mentioned there into the chat. I did want to say that, we have to run a quick poll here at the end, I'm afraid. So this is our final part of our Q&A is going to be to ask some questions of our audience members. So there
Fiona,
should
I
be...
can put those links in the chat for you while you do that. Oh, never
Oh,
mind.
that would be grand. Thank you. I'm like trying to do
Okay.
2 things at once and clearly not succeeding. So Nicole's going to pop the chat links for you. They're really great links. So, and I would really encourage you to sort of copy them, paste them somewhere safe, bookmark them in your browser so that you can go back to them. There's so many great resources there, both for people with ultra-rare bleeding disorders and for healthcare professionals. So yeah, really do take a moment to grab those out of the chat and save them. And then also, if you do have a moment to fill in the poll, we would really appreciate that. That would be great. And just to let you know that the questions, your answers are collected anonymously. And while people are doing that, I will just take a moment to thank everybody today. I would really like to thank Frances and Doctors Williams, Lim, and Rottenstreich for sharing your expertise and your time with us this afternoon. I think we really learned so much, and it was really great to hear, you know, all of your expertise and also your personal experience. Like, this just feels to be a field where it's all very personal, and it's such a fantastic community. And so I really appreciate everything you've shared with us today. This recorded webinar will be available on Friday, December 8th at hemophilia.org under the events tab. If you select past events, you will find all of our archived webinars there. Also available in the events tab is the schedule of upcoming webinars in this series. Join us next week for the Women, Girls, and People with the Potential to Menstruate Summit Overview, Discovering the Roadmap for Change. Thank you so much for joining us this afternoon, and have an excellent week.